Hello, everyone, and welcome to our first module on the autonomic nervous system. Let's start by talking about some of the vocabulary we use when we're talking about the human nervous system. So, when we refer to the somatic nervous system, we're talking about voluntary actions carried out by skeletal muscles, things like movements of our arms and legs, or things like speech. In contrast, when we talk about the autonomic nervous system, we're talking about involuntary actions. So these are things that require nerve innervation, but they aren't voluntary actions. So things like contraction of smooth muscles, glands, things like salivation and vessel constriction, things like heart muscle contraction. We can't make or stop any of these things from happening. They're not under our voluntary control, but they are controlled by nerves, and those nerves are part of the autonomic nervous system. And then finally, sometimes we'll talk about the enteric nervous system. This is a collection of nerves that's found only in the GI tract, and I talk about it in more detail in videos in the GI section. So in this video, we're going to focus on the autonomic nervous system, the nervous system that carries out involuntary actions. And the first thing you have to appreciate about this system is that anytime the brain wants to use this system to carry out an involuntary action, it's going to use two neurons to generate the effect. So let's look at this drawing on the screen here, and let's imagine that our brain decides that it wants our heart rate to go up. That's an involuntary action. Well, it's going to need to send a signal to the heart, but it's going to do this using two neurons. The first neuron is called the preganglionic neuron. This neuron is going to synapse and trigger a second neuron called the postganglionic neuron. And that second neuron is going to go and create the effect, like increasing the heart rate. And the reason these neurons are called preganglionic and postganglionic is because the places in the human body where they come together are called ganglions. Ganglions are clusters of nerve cells. So as we'll talk about in a minute, there are ganglions found throughout the body where you have the first neuron in an autonomic nervous system action meeting the second neuron in an autonomic nervous system action. And that's all part of this two-neuron chain required to create involuntary effects. So if we zoom in on this whole system a little further, we find that there are two synapses involved in this system. Remember, the system starts with the preganglionic neuron. That neuron is going to release some neurotransmitter that will bind to a receptor on a cell body of the second neuron, the postganglionic neuron. So the first synapse in this two-neuron chain is the synapse between the preganglionic and postganglionic neuron. But then there's a second important synapse. That's where the postganglionic neuron releases a neurotransmitter that binds a receptor on the effect site, for example, the heart or our salivary glands or some other area in the body where involuntary actions are carried out. So the point I want to emphasize here is that we have two synapses involved in this two-neuron chain in all autonomic nervous system effects. We have the first synapse between the pre- and postganglionic neuron and the second synapse between the postganglionic neuron and the effect site. So now that we understand that there are two important synapses in the autonomic nervous system, we can talk about the neurotransmitters that work at those synapses. There are two major neurotransmitters that are part of the autonomic nervous system. The first one is acetylcholine. The second one is norepinephrine. Acetylcholine binds to receptors called cholinergic receptors, and there are two subtypes, nicotinic cholinergic receptors and muscarinic cholinergic receptors. And then the muscarinic subtype is broken down even further into many different subtypes like M1, M2, M3, all the way up to M5. And we'll talk in more detail about what all these receptors do shortly. Norepinephrine is the other major transmitter. It's also called noradrenaline. It binds to adrenergic receptors. There are two major subtypes, alpha and beta, and then those are broken down even further into alpha-1 receptors and alpha-2 receptors, beta-1, beta-2, and beta-3. The autonomic nervous system has two important subsystems or branches that carry out involuntary actions throughout the body. So let's talk about those now. The first one is called the sympathetic nervous system, also known as the fight or flight system. And it gets its name because the involuntary actions of the sympathetic nervous system are all actions you need if you're going to fight or flee from something. Some of the important things that activate the sympathetic nervous system I've listed on this slide. Exercise is a big one. Another one is hypoglycemia. If you ever meet a patient who has low blood sugar for any reason, you will see all the involuntary actions of the sympathetic nervous system occurring at the same time. The sympathetic system is also activated anytime there's low volume in our vascular system. So for example, someone who's hemorrhaging or who has hypovolemia for any reason. Another major activator of the sympathetic nervous system is heart failure or cirrhosis. These are both pathological states where blood volume is not in the arterial system. It's pooling in other systems like the splanchnic vasculature and cirrhosis, or the veins and heart failure. And so because you're underfilling the arterial system, that activates the sympathetic nervous system as well. In contrast, the parasympathetic nervous system is called the rest and digest system. And that's because this system carries out involuntary actions that are important when you're resting or when you're digesting food. So major activators of the parasympathetic system are things like sleep. If you ever spend time in the hospital in the middle of the night and you walk near the heart monitors, you will see that patients have very low heart rates. That's because of their parasympathetic nervous system being activated by sleep. You also see major activation of the parasympathetic system after a meal. That's why it's part of the rest and digest system. Shown on this slide is a picture that summarizes the different involuntary functions of the parasympathetic versus the sympathetic system. And what you want to appreciate is that for the most part, these two systems oppose one another. So for example, the sympathetic system dilates the pupil because when you're in a fight or flight stage, you want your pupil to dilate to allow more light into the eye so that you can see better. In contrast, the parasympathetic system constricts the pupil because when you're resting or sleeping, you don't need to have a dilated pupil and the pupil can constrict. And then if you go down the rest of this image, you can see different functions that are carried out by the two systems and how they're opposite from one another. So for example, the sympathetic nervous system inhibits the flow of saliva. You don't need saliva when you're fighting or fleeing, but the parasympathetic system stimulates saliva because you need that when you're resting or digesting. And then you can pause the video if you want. You can look at the rest of these actions. I'll go through all of these in the remainder of the slides in this video and some of these actions in the second video on the autonomic nervous system. Let's talk in a little bit more detail about the anatomy of the autonomic nervous system. So remember what I said before, that autonomic or involuntary functions require two neurons. The first neuron is going to synapse on the second neuron, and that's going to go and synapse on some effector site. And this place where the first neurons are synapsing on the second neurons, remember we said that's called a ganglia. So the ganglia for the sympathetic nervous system are all found close to the spinal cord. They're called paravertebral ganglia. They're found at the spinal cord at the level of T1 to L3. So if you look at this image on the slide here, it shows the spinal cord. This is the sympathetic nervous system. And all these ganglia are found right here from T1 down to L3. These are the sympathetic ganglia. That's where you have that first neuron synapsing onto the second neuron. The parasympathetic system, however, is different. So the ganglia for the parasympathetic system are found near the target organs. So they're found throughout the body close to the place where they're going to carry out their effect. So if you look at this drawing on the right side, this shows the parasympathetic nervous system. Up at the top here, we have ganglia related to cranial nerves. So these are cranial nerves or branches of cranial nerves. And they're going to be the first neuron in the two-neuron chain, and they're going to go and synapse at ganglia that are near the effector sites of the parasympathetic nervous system. So for example, you can find parasympathetic nervous system ganglia near the eye that are going to carry out eye functions, near the lacrimal and salivary glands, or near cervical blood vessels. We then have this cranial nerve that goes way down into the chest. That's the vagus nerve, cranial nerve 10, and it gives off lots of branches that go on to form ganglia near target organs like the heart and the lung and the stomach and the liver. And then finally, down in the pelvis around S2 to S5, you have first neurons in the two-neuron chain of the parasympathetic system that are going to exit the spinal cord, and they are going to form ganglia near effector sites like the colon or the rectum or the bladder or the genital. And so the take-home point here is that all the sympathetic ganglia are found at the paravertebral level near T1 to L3, whereas all the parasympathetic ganglia are found near the target organs. Now let's talk about a super high-yield topic, and that is the topic of how signals are transmitted through the autonomic nervous system with a focus on which neurotransmitters and receptors are involved. So remember, the autonomic nervous system always uses two neurons. The first neuron is called the preganglionic neuron. It synapses with the second neuron, which then synapses at the effector site. And so we're going to talk about the different neurotransmitters and receptors that are used at either the first synapse or the second synapse. The first synapse is a ganglionic synapse. Remember those ganglions we talked about in the last slide that are found near the spinal cord for the sympathetic system and near effector sites for the parasympathetic system. The ganglionic synapses always use acetylcholine as the neurotransmitter, and it always binds to nicotinic receptors. Now, the important thing to know about these ganglionic synapses is that nicotinic receptors are also found on skeletal muscle fibers. They are the major receptor type at the neuromuscular junction where neurons synapse with muscle fibers. And this has important consequences when it comes to pharmacology. If you're going to modulate nicotinic receptors, either activate them or block them, the dominant effect is going to be on muscles, not the autonomic nervous system. Drugs that activate the nicotinic receptors will cause muscle fasciculations. Drugs that block nicotinic receptors will cause paralysis. So this is important when you're answering board questions. If they describe a drug or a toxin or something that interacts with nicotinic receptors, the dominant clinical features are going to involve the muscles, not the autonomic nervous system. Even though there are nicotinic receptors in these ganglionic synapses, usually the effects of drugs that activate or block nicotinic receptors is all involving the muscles, not the autonomic nervous system. Okay, so that's the ganglionic synapses, but now we're going to talk about the synapses between that second neuron, that postganglionic neuron, and the effector sites. And these synapses are different depending upon whether you're talking about the parasympathetic or the sympathetic system. For the parasympathetic system, the major neurotransmitter is acetylcholine, and the major receptor type is muscarinic. And as I mentioned before, there are lots of subtypes of muscarinic receptors, 1, M2, M3, M4, M5. The M2 subtype receptors are found in the heart. The M1 subtype of receptors are found in parietal cells in the stomach. They produce acid. And then most other locations throughout the body have the M3 subtype of muscarinic receptors. These are the receptors you find on blood vessels, in the lungs, in salivary glands. So what you always want to remember about the subtypes of muscarinic receptors is summarized right here. M2s are in the heart, M1 are in the stomach. They produce acid. The M4 and M5 subtypes, in case you're wondering, are mostly found in the central nervous system, and they're not that important clinically. It's really the M1, M2, and M3 subtypes that are most clinically relevant. Contrast that with the sympathetic nervous system, where the major effector neurotransmitter is norepinephrine. It binds to adrenergic receptors, and as we talked about earlier, there are alpha and beta adrenergic receptors, and then there are subtypes of these receptors like alpha-1 and alpha-2, and beta-1 and beta-2 and beta-3. So in general, when you're talking about the sympathetic nervous system and you're talking about a neuron that's innervating an effector site, the neurotransmitter is usually norepinephrine, and the receptor is usually some type of alpha or beta adrenergic receptor. There are, however, two exceptions, and let's talk about those now. And those two exceptions are the adrenal glands and the sweat glands. These structures are innervated by the sympathetic system, and they do not use norepinephrine on adrenergic receptors. Let's first talk about the adrenal gland. It's directly innervated by the sympathetic nervous system. The neurotransmitter the sympathetic system uses to activate the adrenal gland is acetylcholine, and it binds to nicotinic receptors. So this is different from using norepinephrine on adrenergic receptors as you usually find in the sympathetic system. What this means is when the sympathetic nervous system becomes activated as part of the fight or flight response, it will trigger the adrenal gland using acetylcholine binding to nicotinic receptors so that the adrenal gland releases hormones into the blood circulation. These hormones come from the adrenal medulla, which is a specialized region of the adrenal gland that I talk about in the endocrine section. Basically, you can think of the adrenal medulla as a specialized ganglion. It's not per se a ganglion, it's not a collection of neurons, but it behaves like the ganglion do, and that's why acetylcholine on nicotinic receptors is what activates the adrenal medulla. When the adrenal medulla gets activated, it's going to produce mostly epinephrine, about 80%, but also a little bit of norepinephrine, and it's going to release these substances into the bloodstream, and they're going to circulate throughout the body, and this is part of how the sympathetic nervous system response gets amplified by these hormones being released by the adrenal gland into circulation. And then sweat glands are another unusual situation in the sympathetic nervous system. They can be activated by the sympathetic system, but the neurotransmitter is not norepinephrine, it's acetylcholine, and the receptors are not adrenergic receptors, they are muscarinic M3 receptors. And so when the sympathetic nervous system is activated, for example, in someone who's hemorrhaging, they will sometimes have sweaty palms, and that's because the sympathetic nervous system is releasing acetylcholine onto muscarinic M3 receptors found in the palms, and that's causing sweat to be produced. Let me briefly mention dopamine. It's a minor neurotransmitter of the sympathetic nervous system. The major neurotransmitter, as I said, is norepinephrine, but there are some nerve fibers that use dopamine. Most of these are found in the kidneys, and they innervate blood vessels in the kidneys, so the renal vasculature is influenced by dopamine through the sympathetic nervous system. Dopamine release in the kidneys can vasodilate blood vessels and increase blood flow to the kidneys. And because of these properties, dopamine is sometimes given as pharmacologic therapy, which I talk about in a lot more detail in the videos on adrenergic drugs. But the idea here is that at low dosages, dopamine will increase renal blood flow, and this is sometimes helpful. At higher dosages, dopamine can bind to alpha and beta receptors, and this will cause vasoconstriction and raise the blood pressure. So these effects here, increasing renal blood flow and raising the blood pressure, are the reason that dopamine is sometimes administered to treat forms of shock and hypotension. And once again, I talk about this in detail in the videos on adrenergic drugs. For the rest of this video, I'm going to focus on smooth muscle, which is a major target of the autonomic nervous system. Smooth muscle refers to muscle fibers that are not under voluntary control, like skeletal muscle fibers. And you find smooth muscle throughout the body in places where the autonomic nervous system wants to exert effects. So, for example, there's smooth muscle in our arterioles and our veins, so that the autonomic nervous system can cause contraction or relaxation of these vessels. You also find smooth muscle in our bronchioles, so that the autonomic nervous system can manipulate airflow. You also find it in the GI tract and many, many other places. Let's first talk about what the sympathetic nervous system likes to do to smooth muscle, and it can contract or relax smooth muscle. Depends on which tissue bed you're talking about and what effect the sympathetic nervous system wants to create. The way this works is there are different receptors in different tissue beds, and because of the different receptor types, norepinephrine has different effects on smooth muscle in different tissue beds. When the sympathetic nervous system wants to generate smooth muscle contraction, what it's going to do is activate alpha-1 receptors. And the major place where you find these receptors are in vascular smooth muscle, and by this I mean smooth muscle surrounding arterioles and veins. When these alpha-1 receptors found on arterioles and veins get activated, that causes vasoconstriction. Basically, it shrinks the size of the blood vessel. There are lots of alpha-1 receptors in the blood vessels associated with the skin and the GI tract. So in a person who's in a fight or flight sympathetic response, you will have less blood flow to these regions. So for example, in someone who's hemorrhaging, their skin is often cold, and that's because alpha-1 receptors have been activated and there's less blood flow to the skin. The reason the body wants less blood flow to the skin and the GI tract is because that allows it to go to more important areas like the lungs and the heart. This is also going to raise the blood pressure in general. When you have less blood flowing to these organ systems, you get more blood filling the aorta and the arteries, and that raises the blood pressure. And this is another important effect of sympathetic nervous system activation. It's carried out via alpha-1 receptors on vascular smooth muscle. So key things to know related to alpha-1 receptors is that when the sympathetic nervous system is activated, some of the effects you're going to see through alpha-1 receptors are, first of all, less blood flow to the skin and the GI tract, higher blood pressure in the arteries, and then also you're going to get constriction of veins from alpha-1 receptors on veins. This is going to decrease the venous blood volume, and that's actually a good thing because it's going to force that blood volume back to the heart to try and keep the arteries filled with blood and keep up the blood pressure. In contrast, when the sympathetic nervous system wants to generate smooth muscle relaxation, it uses beta-2 receptors. In blood vessels, you find beta-2 receptors on smooth muscle around skeletal muscle tissue in the liver. So when the sympathetic nervous system is activated, you get more blood flow to these regions. Remember on the last slide, I told you you get less blood flow to the skin and the GI tract, but muscle beds and the liver actually get more blood flow when the sympathetic nervous system is activated. And that's because of beta-2 receptors. But then really the important place where beta-2 receptors play a role is in the lungs. The bronchioles have smooth muscle with lots of beta-2 receptors. And so when the sympathetic nervous system is active and you're in a fight or flight mode, you're going to get bronchodilation. And this is going to allow more airflow in and out of the lungs so that you can ventilate and oxygenate in the fight or flight response. So that's the sympathetic nervous system. It can contract or relax smooth muscle throughout the body using alpha-1 and beta-2 receptors. But what about the parasympathetic system? It can also contract or relax smooth muscle, but it does this using different neurotransmitters and different receptor types compared to the sympathetic system. There are a couple of places in the body where the parasympathetic system generates smooth muscle contractions. A big one is the lungs. Smooth muscle contraction in the lungs leads to bronchoconstriction, and this is something that's carried out by the parasympathetic system. Another super important place for the parasympathetic system is the bladder. The detrusor muscle, which contracts so that you can urinate, has parasympathetic innervation. And when it's stimulated, the bladder will contract, and that's part of how you urinate. And these effects here in the lungs and in the bladder are direct effects of acetylcholine as part of the parasympathetic system being released and binding to muscarinic receptors. And in the second video on the autonomic nervous system, I talk a lot more about the lungs and the bladder and which receptor types you find there. The parasympathetic system can also cause smooth muscle relaxation. This is important in the GI tract for peristalsis. It's also important for penile erection. The way an erection occurs is you get more blood flow to the penis, and for this to happen, smooth muscle has to relax, and that's carried out by the parasympathetic system. What's unique about smooth muscle relaxation related to the parasympathetic system is that it's an indirect effect of acetylcholine. What acetylcholine does to cause smooth muscle relaxation is it triggers the release of nitric oxide. Nitric oxide is also called endothelium-derived relaxing factor because it's produced by endothelial cells lining blood vessels. So when the parasympathetic nervous system wants to cause smooth muscle relaxation, for example, to achieve an erection, what it's going to do is it's going to activate the endothelium to release nitric oxide. And then nitric oxide is a very powerful smooth muscle relaxer. And so it's the nitric oxide that directly causes smooth muscle relaxation. Acetylcholine and muscarinic receptors, that's all an indirect part of this process, and that's caused by activating receptors on the endothelium. And that concludes our first module on the autonomic nervous system.